Hello, I'm Lauren Meffin, speech language pathologist, owner and operator of Wildflower Therapy. Today, we are going to take a look at two internal pharynx movement of food through the throat. So let's do this. After a patient experiences head and neck cancer, they will often come to us following their treatment of chemo and radiation. The timing of when to do a swallowing study is pretty important in our world. We like to complete a swallowing study somewhere between 6 to 12 weeks post-treatment. The reason for that is we want to get our patient back to as close to a sense of normalcy as soon as we can. However, there's times when we are too early. And what I'd like to show you today is an example of a swallowing study that we completed here at the clinic. It's a fiberendoscopic swallowing study. We place a camera inside our patient's nose and we take a look down in through what we call the pharynx. And ideally, we like to see the structures of what we call the larynx, the voice box. So what you can see here in our screen is we're going to watch about a 15-second clip of about a significant amount of green thickness, that's food coloring, that we have already given our patient to swallow. Now I'm going to press play and you're going to see my camera moving around a lot because I'm trying to get a picture. Now, if I pause us here, what we're looking at in this region is what we call the base of the tongue, okay? This green bleb back here, kind of that green space, is the epiglottis. So you can see that in our patient that we're looking at, let's press play again, this epiglottis is very thick, very edematous, okay? It has very little room to move before it contacts what we call the posterior pharyngeal wall or the back of the throat. So in a perfect world, this patient's liquid and food will move through their throat, but right now what they're experiencing is a significant amount of swelling. So we're going to play that again. I see my base of tongue in the bottom of the screen. I see my epiglottis right here. My epiglottis has a thick amount of liquids that we have given the patient to swallow. Now that is actually thin liquids that we've given them, but it's sticking with the amount of secretions and their patient's sensation of that thick, slimy coating after radiation. So we see a significant amount of erythema or redness and swelling here in the pharynx. We do not see the vocal cords. Now, if I wanted, I could try my absolute best to go sneak between this epiglottis and the pharyngeal wall and try to get a look at that patient's larynx. When I do that, I have about that much wiggle room, you see right there, that I could sneak my camera in. What I'm also going to do is I'm going to throw my patient likely into a gagging sensation, and I can tell you this because I tried to do it, and I still couldn't see beyond that region the larynx, the vocal cords, or the upper laryngeal vestibule the way I needed to see it. But what I can gather from this study alone right here is my patient has a very difficult time moving liquid and food through their pharynx. Why? This is internal edema, okay? From a therapeutic standpoint, there is no evidence-based practice that tells us how to treat internal edema. It's very important that we as clinicians understand that we have to communicate with the ear, nose, and throat physician, the radiation oncologist, and the oncologist team to really be able to help with this, okay? So what I would want for you to take away from this is I want you to take away that sometimes we mean well. We want to get our patients swallowing. But the truth is they're not ready. The patient's not ready to be able to push food. Now, can this patient drink? Yes. Am I going to encourage that they continue to drink? Absolutely. Is it uncomfortable for them to drink? Yes. Is it sticking when they swallow? Yes. Does that mean they should stop? Absolutely not. We have to continue that they continue to swallow and utilize the movement. Remember, the muscle pump activity will help to mobilize any lymphedema, okay? So this particular patient is 12 weeks actually post-treatment. They are 12 weeks post-treatment of radiation and chemo. They were not treated surgically. But what you're seeing is that regardless of the timing, this particular patient has a significant amount of swelling in there, even though we waited the full 3 months. Now, one of the questions I hope you're asking is, what did they look like clinically when they were sitting across from me? What did they look like? Or if they were sitting across from Taylor, my other speech pathologist who works with our head and neck cancer patients here. So they looked like a lot of clearing their throat. They looked like coughing after they swallowed. So they'd take a sip of liquid, multiple swallows, 3 and 4 swallows, and then coughing. So do I stop them drinking water because the inside of their pharynx looks like this? No, I keep them drinking water. I expect these patients to be aspirating, okay? It is very, very important that as clinicians, we don't make the judgment call of NPO. The ability for our patients to continue to try to swallow during this study is absolutely essential to their long-term rehabilitation. The answer of the question as to how long until they're ready for food truly depends on the internal swelling and decreased edema. Thank you for joining us. I hope that this is helpful for you or for your patients. Have a great day.